Good morning, everybody. My name is Ruth Nakitongwangu. I'm the Infection Prevention and Control Coordinator for Lubaga Hospital, and I work with Lubaga Hospital. I'm going to talk about linen in different aspects. And for this moment, I'm going to discuss the risk on reuse of linen by the individuals, patients we are taking care of, and maybe the hotels. Those who go and visit the hotels may be rest from the hostels. So the risks that can expose someone using reused linen. Number one, when you put on linen, definitely you may put on clean or unclean linen. One who is going to put on linen must be very sure that I'm putting on clean linen. Clean linen must be processed, washed, dried, ironed. Then you put on that clean linen. When you put on the linen, definitely, depending on the work you are doing, you may be exposed to environmental contamination. Definitely in our environment, we have those organisms. There is a lot of dust. We are in an environment with a lot of dust, especially in dry seasons. We find we are in dusty areas. So you are moving in dusty environment. So the linen you are putting on, the clothes you are putting on, can become dirty and soiled with dust. Again, when you put on, we are human beings. We definitely have the normal bacterial flora on our bodies and mucous membrane. So when you put on linen, the normal flora on your body definitely gets in contact with the linen you are putting on. And we definitely know scientifically, when the normal bacterial flora moves from where it is supposed to be and transmitted to another place, then it becomes a pathogen. Those are microorganisms that are capable of causing diseases. So if you transfer it from your body through the linen, maybe to another place, then that place may be contaminated. So this causes us to put on linen once. When you remove it, you should not put it on again. What we need to know, it is already contaminated. It has the dust from the environment, organisms from the environment, and from your body, the normal flora. That is the reason why we should always put on clean linen. Whenever you remove the linen, the clothes must be processed through washing, drying, and ironing. That is number one. That is for individuals, in our homes, people we stay with, and the entire community. Now it is very important for those who are managing hotels to make sure whoever is in rendering services, hotel services, must be trained in this aspect of managing linen and keeping safety of the individuals. So we expect hotel managers to ensure the staff personnel are well trained in management of linen, personal hygiene. As I have expressed, when you put on the clothes, you sleep in the beddings, they must be processed on a daily basis, should never be reused between different customers. Then we come to health care facilities. This is very important. I have expressed that we have each individual has the normal bacterial flora, and these are now patients who are coming. We have different types of patients. There are those who are in a health care facility. There are those who are health who may get the infections and they are eliminated, and those who are really immunosuppressed. These ones are the patients we should really take care of, so that we use clean linen when we are managing our patients, that no patient should get any infection from contaminated linen. That causes our laundry services to be very keen in managing the linen. Linen is used, dirty, soiled and contaminated, well processed, and as I said, you wash. For hospitals, we definitely make sure we use heat and chemicals, make the linen very clean, free from organisms, dried, ironed, and made really clean for the users. And as I said, nurses, housekeepers must make sure each patient use linen, and after use it is processed. There is no sharing linen between patients. There we are keeping safety of our patients. Even in the healthcare facility, we have the personnel using this linen, like in the operating theaters. Definitely the doctors, surgeons, and the nurses working with that team, they put on scrubs that are shared. So they are not shared in between before processing. Each one must put on a scrub. After use, it is taken back for processing. So there is no reuse between personnel. You put on, hang it, another one comes to put on. No, that one can lead to cross infection. So all this linen, if it is shared, it can cause skin infections like ringworms and some other infections that can even penetrate through the body and cause infections in our patients. So I call upon all those who are producing our linen, we use clothes, beddings, those who are procuring this linen for different uses, aspects, those who are transporting linen, because once goods are manufactured, they are transported to stores where they should be stocked for others to come and procure. All this process must be in a system that they are trained to keep safety. Linen should never be contaminated, and all those who are users to make sure they get this message. Each person should not try on a cloth which has been put on by another individual. If this can be communicated to our communities, I think we shall be able to reduce on the number of those who acquire infections through used linen. So I call upon all those who are managers to take their role and responsibilities, train people, make sure the systems are in place and everyone is aware. Our communities, people we stay with, those who are working in the healthcare facilities, hotels, and any other business that can access use of linen. So for that reason, I would like to call upon all stakeholders, all well-wishers to come and attend a big event that will take place in Lubaga Hospital on 15th and 16th of August. That is when we are launching our Linen Day Africa. It is the first event in the entire continent of Africa. So don't miss this opportunity. I thank you so much for listening, for God and my country.